Having a baby is something that a lot of people would like to do. Most women are able to conceive naturally and deliver healthy, beautiful babies. However, there are some males and females who suffer with infertility issues. Infertility can be described as the failure to achieve a successful pregnancy after 12 months or more of regular unprotected intercourse. For these individuals, infertility treatments have evolved to improve the prognosis for couples with these issues. These treatments include pharmacological agents, therapeutic insemination, in vitro fertilization, surrogacy, adoption, and more. These treatments should be decided on an individual basis, and these patients should be notified of the pros and cons of each. However, there is a higher incidence of multiple births related to infertility treatments. Some couples may find this exciting, whereas others may not be ready for multiple children at once. They may only just be ready for that one. I decided to choose this topic because I personally know individuals who have suffered with infertility issues and who have pretty much been willing to try anything to have a child. I'm sure there are other people out there like this, and they may not really know the pros and cons, or they may not realize that these treatments that they're trying to conceive that one child that they've always wanted may result in 2, 3, 4, and maybe even 5. I feel that these individuals should be notified of all the possibilities of what could happen if they take these treatments, and I just want to be able to be well versed and to help others who are in this topic. The therapeutic insemination is mostly for when the males have the fertility issue and the sperm is put directly into the womb to fertilize the egg. Whereas in vitro, it may be the woman and her egg is taken out, it's fertilized outside of the womb, and then it's placed back in. The ethical issue with these is that sometimes they decide that you may need to terminate one embryo or a few embryo in order to save the life of others, because with these multiple births, there is a high incidence of preterm labor and low birth weight infants. But the question comes, how do you know which embryo to terminate? Do I feel like abortion should be, am I okay with abortions? You have to think about these different things, and these patients have to be given all of the information so that they can make the best decision for themselves. Also, there are a lot of cultural things that go on, because some people may feel like doctors are trying to play God when they are trying to allow someone to have a child that could not naturally get pregnant on their own. They may feel like they are altering with God's plan, because if this person could not get pregnant on their own and you're giving them these treatments to change that, who are you to decide that this is what's best for that person? So there may be some conflict between families, even between couples, on deciding whether these are the best treatments or not. Also, psychologically, the infertility can break these couples down. They may break marriages down and leads to a lot of depression, anxiety when you're going to the next meetings. The blame game, blaming whose fertility is messing with what so that they can't have this child. So there's a lot of reason. I feel like this was a really good topic to study. I really enjoyed doing this paper, and I feel like anyone who is thinking about fertility treatment should understand that there is a chance for multiple births related to these different fertility treatments.